Welcome back. The National Council of Social Service is investing $5.6 million to make support for behavioural addictions more accessible in Singapore. Under the 3-year Aspire program, 10 social service agencies will be trained to help people struggling with issues such as excessive gaming, gambling, and pornography use. Agencies reported more than 780 new behavioural addiction cases in 2024, up from over 520 in 2020, with some clients as young as 12, as Sherlyn Seah reports.
For Steve, what started as exposure to pornography at around 11 or 12 eventually became something he could no longer control. At his worst, he would spend 2 to 4 hours consuming explicit content, using it as a way to cope with difficult emotions and stress.
When I tried to stop, I couldn't. And that's when I realized that something's a bit wrong. Because I think I would say, okay, this will be the last time I'll do it. And then just hardly even the next day, I'll be thinking all about it again. And it's like, I don't want to do it, but I have to do it.
But shame and stigma meant he initially kept the problem to himself. Years later, he joined a support group before seeking professional help at We Care Community Services. He's now been addiction-free for 6 years. We Care specializes in addiction recovery. It says problematic pornography use has seen the sharpest rise, from 106 cases in 2020 to nearly 200 in 2025. Clients are also getting younger. About 3 in 4 are below 35, with some as young as 12. It says greater access to digital devices and online platforms is contributing to the trend.
We may recommend medical interventions or psychiatric interventions if that's needed. Okay. Otherwise, many people would also progress to psychotherapy with us at a one-to-one level, where we are trying to understand what led to this behavior in the first place. Even if we actually help them to manage, prevent, and avoid the triggers that led to the behavioral addiction itself, we need to treat and deal with the underlying causal factors.
The Aspire initiative aims to intervene earlier. 10 social service agencies will be trained to screen such addictions and support cases in the community. More complex ones can be referred to We Care. Reach Community Services has been seeing children as young as primary school age struggle with social media and smartphone use.
Before Aspire, we might need to refer clients to another agency to receive addiction-related support. But now with Aspire, we ourselves can be the ones to deliver a more integrated service to our clients because we already have the rapport and engagement with them. Yeah, so with us doing so, it lessens the barriers for our clients to seek help, and we can bring forth the service in a more timely manner to them.
The partnership adds to ongoing efforts to tackle behavioural addictions. Over the past year, NCSS has conducted learning sessions for more than 350 policymakers, social service professionals, and frontline workers. It has also rolled out e-learning resources on how to better support youths.
And for more analysis, we're joined by Dr. Adrian Wang, who runs his own psychiatric practice. Now, Dr. Wang, thank you for coming in today. Let's start with, first of all, how can we tell and differentiate between heightened use and addiction? What are some signs to look out for?
So in an addiction, it's more than just using it for a prolonged period. There are 3 things in an addiction. Firstly, it dominates the person's life. They're thinking about it when they're sleeping, when they're waking, when they're at work. And secondly, very importantly, it causes harm. It harms their relationship. It harms their work. And thirdly, there's craving. You keep seeking for it, and when you don't get it, you feel anxious, you feel agitated. So 3 things. It dominates you, you crave it, and most importantly, it causes damage to your functioning, your relationships, your daily life. Yeah. That's when it's more than just doing it too often. It's an addiction.
So for those who feel that they might be exposed to this or they might be addicted to something, what are the barriers of help and how are they different from, say, a young adult and perhaps a child or a teenager?
There's a lot of stigma associated with getting help for an addiction. People see it as moral failure. You're a bad person. And in different age groups, there are different barriers. For young people, sometimes for kids, sometimes they just don't realize it. They don't know it's a bad thing. Also, kids are afraid of punishment. If my parents find out, if my teachers find out, I'm going to get in trouble. So fear of being punished is a barrier for them. For older kids, for teenagers, adolescents, it's shame and guilt. Why do people know that I can't control this? And also teenagers have more autonomy and independence. They can push back. So they have more access, they can spend money. So they're more difficult to control. But the overarching issue is shame and guilt. It's just, it's nobody wants to admit a weakness.
Yeah, and with the shame and guilt often comes secrecy. And secrecy really is a big part of how addiction is perpetuated. Can you tell us a bit more about that?
Exactly. So addictions thrive in secrecy. It's when people hide, that's when they do their addictive things. So for families, for caregivers, for friends, if you want to support your loved one who has an addiction, the wrong way to do it is to come at them and say, why are you doing this? To come from a moralistic point of view. To support them is to give them a safe space, which these efforts are doing, right? To tell them that, hey, help is available. It's important to get help early. We don't want to wait till it's a crisis. So once we give them a safe space that we know that they can get help, then they're more willing to step forward.
You mentioned earlier that addiction is not a moral failure, and it's important to change mindsets about that. Can you break it down for us why it's so difficult to quit any form of addiction? Can you take us through what happens in the brain?
So an addiction is linked to reward and learning. And all the things that people get addicted to, gambling, video games, even TikTok and social media, they're designed to trigger dopamine in your brain. Dopamine is what you need to feel a sense of joy and reward. So every time we scroll and we slide, or every time I get that like on Instagram, dopamine in my brain lights up. So it's just human evolution. We're wired to want these things. So that's number one. It's hard because there's a circuit in our brain that makes us keep going back to it. Secondly, I think everyone's wired differently. My durian theory. Some of us love durians. I like durians. And some people just like, what's the point, right? So if you have an addiction and you like something, like a durian or gambling or alcohol, and another person doesn't have that addiction, it doesn't mean that the person with an addiction is a weak or a bad person. There's a gene, there's something in their brain that turns them on, that switches on the light in their brain and not in yours. So don't point a finger. It's just that you haven't found your poison yet. And your poison doesn't have to be all these bad things like gambling and pornography. It could be a relationship. It could even be your work. So there's a biological basis to it. Everyone is vulnerable. But there's a third thing that I'd like to highlight. Addictions and addictive behavior, sometimes there's an underlying cause. There's depression, there's loneliness, there's stress. So when we address addictions, we need to look at all these layers. Why is the person behaving this way? What's setting up that circuit in his brain? What's enabling him to keep pressing that button to get what he wants? And beneath that, is he lonely? Is he sad? Is the child being bullied in school? Is he coming from a home with problems? And his addiction is his escape. So it's not moral failure. It's multi-systemic.
There has to be more curiosity about the person and their situation instead of judgment.
Exactly, curiosity to ask about them.
So how can loved ones or even the general public, be empowered then to support those who are suffering from addiction and then encourage them to come out?
Look for the warning signs. It's not just spending a lot of time on the behavior. The warning signs are a change in their mood, their emotions. If they look sad, they look depressed, they're neglecting their work, they're neglecting their exercise, it's affecting their relationships. Also, if they're hiding, if there's secrecy involved, look for the warning signs. We want to give them a safe space, like I said, that, hey, you can come and talk to me. I'm your friend, I'm your partner. I'm going to hold your hand and walk you through this, but there's a boundary we need to draw because helping them doesn't mean enabling them. You mustn't keep just paying off his gambling debts and keep solving his problem for him. So boundaries must be drawn, but you've got to give them a space to come forward because an addiction thrives in secrecy. And if the person says, hey, you're not judging me, it's not a moral failure, it's a health condition, it's a medical condition, then the person's more likely to step forward. And it looks like we've got more resources now for people to get help. Yeah,
so before we go, Dr. Wang, what are some ways that those who would like to seek help, how can they get that support that they need? Where can they go? And especially those who may not be able to afford one-on-one therapy at any given time.
I think there are a lot of government resources now. I think IMH has a national addictions management program. Can't remember the exact name, but the government does have help for gambling addicts. So I think it's important to tell them that there's confidentiality. No one's going to know, but you have to step forward. And like I said earlier, it's important to get help early. Don't wait till it's a crisis. Also, even if you suffer a relapse and you try to get help, but you fail, failure doesn't mean it's the end. Sometimes it's 2 steps forward, 1 step back, but as long as we keep moving forward, we'll get there.
Dr. Wang, thank you so much for sharing your insights with us. I've been chatting with Dr. Adrian Wang from Dr. Adrian Wang Psychiatric and Counselling Care.